about that the UNICEF. So in health agencies, international health agencies of UNICEF. Okay, UNICEF, it is a United Nations Children's Funds. Okay, emergency funds. So it is a specialized agency for the United Nations. It is established in 1946 to rehabilitate the children in war or revenge on the countries. So it is a headquarter in the New York. Work in the collaboration with the FAO, okay, UNDP and WHO and UNESCO. So providing assistance in the varied field of MCH, maternity, child health, and the environmental sanitation sector. So the funding is derived from the voluntary, from the governmental and the non-governmental organizations. So services provided by the UNICEF, basically child health, child nutrition, family health, and child welfare, educations like formal and the non-formal educations. So after the UNDP, UNDP, so United Nations of Development of Program, so establishment in the year of 1966 to help the poorer nations of develop their humans and the natural resources more of fully. Okay, so या ठिकाणी 1966 मध्ये स्टॅब्लिश झाली होती फॉर द पुअरर नेशन, जे पण पुअरर नेशन असेल त्यांना डेव्हलप करण्यासाठी फॉर द त्यांची ह्युमन, ओके, अँड द नॅचरल रिसोर्सेस त्यांना प्रॉपरली फुल डेव्हलपमेंट देण्यासाठी. सो UNDP like United Nations of Development Program project cover virtually every economic and social sectors जसं की agriculture, industry, education, science and the health, social welfare मध्ये. Okay, United Nations of Development scheme program will be for which virtually every economical condition मध्ये support केला for the social sectors, agriculture, industry, education and the science and health, social welfare मध्ये. So UNDP's activity जसे की for the network of link and coordinations of global and the national efforts to reach these goals. So their focus on helping the countries and build a share solutions to the challenges of the democratic governance. So the poverty reductions, crisis on preventions and recovery, environment and the energy, HIV and the AIDS will be decreased. So FAO like fat of penis, okay, fat of penis, FAO, FAO like the Food and the Agriculture Organizations, FAO was formed by the year of 1945 with the headquarter in Rome. So it is was the United Nations or organization specialized agency created to look after us several areas like world coordinations. So aims of food agriculture organizations, for the chief aim of food agriculture organizations are follow for to help the nations rise living standards. Okay, nations level करायचं for the implementation of standard. Okay, it is an improvement for nutritional status of people and the all country. Okay, implementations of nutritional status in the all our of country of peoples. Okay, so to increase in efficiency like this farming, forestry and the fishery. Okay, increasing in the farming, forestry and fishery. So to better the conditions of rural people and the better the opportunity for the productive work. Okay, it is a providing better conditions of rural peoples and the better of opportunity for the productive work. So ILO is the International Labour Organizations, ILO. Okay, it is was established in 1990. Okay, the International Labour Organizations is the United Nations agency dealing with the labor issues like particularly in international labor standard and decent work for all. Okay, with the labor issues, the particularly and the labor standard will be decent for work for all. The 198 United Nations member state are the member of the International Labour of Organizations. So in 1969, the organizations received the Nobel uh, Peace of Peace of Prize for the implementations of peace among the classes pursuing justice for the workers. and the providing technical assistance to the others developing nations साठी. Okay, implementations for the workers. Okay, providing technical assistance or technology for the other development nations of our nations and other nations. So the main purposes of international labor organizations as follow as to contribute the establishment of the lasting peace by the promoting social justice, implementation of social justice and promoting of social justice. So it is a improve of the international actions like the labor conditions and the living standard of the laborers. Okay, to improve the economical and the socio-economical stability in the country. So USAID, United States of Agency, International Development. United States of so it is a development of USAID. It is a United States of federal government agency primarily responsible for the administrating civilian foreign aid. So it is a responding to the president like Obama pledged in his journey January in 2030. So State of Union address of the joint with our allies to eradicate the extreme poverty to the next two decades. Okay, USAID has to adopt the missions of statement like partner to end of the extreme poverty and the promote to resilient and the democratic societies while advancing the security and the prosperity of the United States. Okay, so USAID operated in the Africa, Asia, Latin America and Europe मध्ये. So activity of USAID like United States of government for is assigning in the number of projects designed to implementations of health in Indian people like malaria eradication असेल, medical eradication असेल, nursing education असेल, health education असेल, water supply and sanitation असेल, control of communicable disease असेल, nutrition, family planning. ओके, ऑल द ॲक्टिव्हिटीज त्यांनी USAIDने प्लॅन केला होता फॉर द इंडियन पीपल ऑफ इम्प्रुव्हमेंटेशन्स ऑफ हेल्थसाठी. ओके, फर्स्ट वन कोणती जे मलेरिया एरेडिकेशन, मेडिकल एज्युकेशन्स, नर्सिंग एज्युकेशन्स, हेल्थ एज्युकेशन्स, वॉटर सप्लाय अँड सॅनिटेशन्स, कंट्रोल ऑफ कम्युनिकेबल डिसीज, न्यूट्रिशन्स अँड द फॅमिली प्लॅनिंग. सो द इंटरनॅशनल रेड क्रॉस और पीस क्रॉप ऑफ द सो त्यामध्ये रेड क्रॉस आपण बघणार आहेत. ओके, रेड क्रॉस, international red cross, it is a non-political and the non-official international humanitarian organization. So first in Geneva or convention to look the place in 1864 and the treaty to the was the sign for the relief or wounded and the sick of the IM in the field. So thus came into the being international committee for the Red Cross. Role of Red Cross in health for it was a largely concern of victim of the war. So mainly it tries to involve in the itself or into the activities like first aid in case of the war, like the situation, maternal child health services. Later it has started to try it and the extent of the research in the disaster management and has the designated for the emergency protocols in the health. So care, defending dignity of the fighting poverty. So care is a cooperative for the assistance and the relief everywhere. So founded in the North America in the wake of the Second War in the year of 1945. It is one of the world's largest independent and non-profit, non-sectorial international relief and the development of organizations care. So provide the emergency aid. Okay, emergency aid provide केली for the care साठी on the long term of the development of assistance. So operations in India 1950s. So activity of care like India focusing on the food support in the ICDS program. Okay, and the development program like area in the lower income state like lower income places. It is the implementation of the health and the income supplementations. So it is a help in the following project like the integrated nutritions, okay, health project, better health and nutritions project, and the anemia control project, improve in the women health project, improve in the healthcare adolescent girls project, child surveillance project, and the improving the women's reproductive health family spacing project. So care in India work in the partnership with the government of India, like state of government of India, like NGOs or etc. Currently it is a project in the Andhra Pradesh, Bihar, MP, Maharashtra, and Odisha, and the UP and West Bengal. So World Bank बद्दल आपण थोडं माहिती घेणार आहे. World Bank, it is established in 1944. Its headquarters is in the Washington. So DC, it is a World Bank. It is a vital source of the financial and the technical assistance to develop the countries around the world. So its missions to fight the poverty with the fashions and professionalism for lasting the resulting and the help to people, the help the themselves and their environmental providing resources. This is sharing of knowledge, sharing of building capacity, okay, forwarding of the implementation of partnership in the public and private sectors. Money. So it is a president currently in the David R. Malebs. So it is a product the low interest loan and the interest free credit and the great grants to developing country like various purposes including investment and education मध्ये investment करायचं, health साठी investment करायचं, public and administration साठी invest करायचं, infrastructure properly growth करायचं, financial and private sectors मध्ये development करायचं, agriculture मध्ये development आणि आपण इन्व्हेस्टमेंट करायचं. ओके, त्यानंतर एज्युकेशन अँड नॅचरल सोर्सेसमध्ये मॅनेजमेंट प्रॉपरली फाइंड आउट ठेवायचं. क्रायटेरिया फॉर इरॅडिकेशन एक्स्ट्रीम पॉवर्टी और ओके हंगर असेल, अचीव बाय काय एज्युकेशन्स, ओके, जेंडर इक्वॅलिटी, रेड्यूस द चाइल्ड मॉर्टॅलिटी रेट, इम्प्लिमेंटेशन इन मॅटर्नल हेल्थ, combat of the HIV, AIDS, malaria, and the other diseases, ensure to environmental sustainability and the sanitation, develop a global partnerships for the development of NGOs and other health agencies. UNFP, United Nations of Populations Fund. So United Nations of Populations Fund are the Populations Fund. It is a lead for the UN and the United Nations or agency delivering in the world. So every pregnancy is wanted or the every birth is safe and the every young is the person for potential is fulfilled. So UNFPA, it is expand the possibility like for the woman and the young people to lead and the healthy and the productive lives. So since in UNFPA it is a starting working in the 1969, so the number and the rate of the woman dying in the complications of the pregnancy or the childbirth so has been held, and the families are smaller and the healthier. So young people are more in connected with the empower of the ever before. So health family will be supported by the training a health worker to delivery quality and the family planning services, supplying contraceptives in emergency situations, ensuring you to friendly reproductive health care, providing counseling and the choices to women who want to avoid or delay pregnancy, educating men on the benefits of birth spacing. For the maternal health by the training midwives and the health workers, preventing and the treatment of obstetrical fistula, supplying a clean birth kits following the disaster, strengthening an emergency obstetrical care, ensuring the reliable supplies of the essential medicines and the equipment. So enabling the birth spacing. ओके, या ठिकाणी आपल्या खूप साऱ्या हेल्थ एजन्सी ज्या की इंटरनॅशनल लेवलला आहे त्या ठिकाणी संपलेलं आहे. आपण बघितलं तर WHO, UNFPA, UNDPA, वर्ल्ड बँक, ओके, FAO, युनिसेफ, त्यानंतर रेड क्रॉस, ओके, ILO, ओके, केअर, ओके, अशा टाईपच्या आपण खूप साऱ्या हेल्थ एजन्सी या ठिकाणी बघितलेल्या आहे. सो आपण या ठिकाणी थांबू. इंटरनॅशनल एजन्सी आपल्या या ठिकाणी संपलेल्या आहेत. ओके, सो आपण नेक्स्ट जे लेक्चर घेणार आहे ते नॅशनल एजन्सीजवर घेणार आहेत. ओके, थँक्यू सो मच फॉर यू.